Swagatam. We would like to welcome you all on behalf of Independent Research Ethics Society. AYUSH Samriddhi, the journey of knowledge sharing, the journey of excellence, is now today arriving at 813th milestone. Thank you. I would like to communicate my sincere regards to you all. Thank you very much for joining as guardian, mentor, supporter, contributor, speaker, and audience. All, thank you very much. So nice of you to see you again. I would like to request Professor Vishnu Prasad Sharma ji for his welcome speech. Professor Vishnu Prasad Sharma.
Namaskar. Good evening to everybody. Respected distinguished guests, eminent speaker, ladies and gentlemen. I, Professor Dr. Vishnu Prasad Sharma, welcome all of you to this evening webinar on social media for health awareness. Most important subject today we have. So in this webinar, I welcome all of you. In this webinar, we have eminent speaker. I want to welcome Mr. Nishant Barma, communication professional from New Delhi. Namaskar, sir, and welcome you to this evening webinar. Next, I want to welcome Dr. Radhika Nagraj, senior journalist and author, Times Plus, manager, Dibba Pharmacy, Haridwar. Namaskar, madam, and welcome
Namaskar,
you
sir.
to
Namaskar.
this evening. Namaskar, namaskar. Once again, I welcome all the eminent speakers, distinguished guests, ladies and gentlemen, to this evening webinar on social media for health awareness. और हम डिक्लेयर करते हो इवनिंग वेबिनार ओपन हो गया. थैंक यू. नमस्कार. वाटो पवनजी.
Thank you very much, sir. Now I would like to request Professor V.K. Agnihotri ji for his brief preamble.
Thank you, Professor Pawan Sharma ji. Welcome all the dignitaries, especially our guest speakers, Madam Radhika Nagraj ji, our one of the good friends of our son, Mr. Nishant Verma ji, and our Tiwari ji, Madam Parul Joshi, and all that persons are doing. Of course, our very respected Jagdish Doma ji, persons are joining with good speed today, I am seeing. So we are here again to celebrate our 813th webinar, making records over records. We have just completed 8th century in the same continuation as far as the webinars count is concerned. So today we are celebrating being a World Social Media Day. We tried to connect persons associated with this field. So we are happy enough that our, especially our Madam Radhika Nagraj ji is with us, and she is not only a journalist or editor and PhD on such, and have a very good knowledge over Bhagavad Gita, along with a very good social worker as far as the medical health field is concerned, and also officiating in Divya Pharmacy in Haridwar. And the second person, our Nishant Verma ji, of course, multi-talented person. When you just put his name along with the communication professional, New Delhi, my son added something more, that he is not that much. He is also a very means responsible person as far as the sale in India is concerned. So in that way, of course, event manager is one of his hobby. So wonderful persons are here with us. And what I can say that the role of social media, as we are celebrating Social Media Day, social media for health awareness. If we don't miss, we can well recapitulate that how responsible, how important, how mandatory that social media's work had been during the COVID-19. Each and every person who was having this simple television, print media, Even the print was restricted because of the just to check the infection persons. The newspaper hawkers, they were also means restricted. So it was only either mobile, Twitter, WhatsApp, or the television. Keep distance, wash your hands repeatedly, take the Ayush Kala, and each and every information. Of course, the data are also being put forward. It may be sometimes walking and persons are putting the television off, but media plays a great role. He properly say promoted the value of our this Safai Kamchari, our police persons, our ambulance drivers, our doctors, nursing staff, every person. This was the media who played wonderful role. And not only this, any crisis, it may be flood, it may be war, it may be any place, or it may be a matter of communicating good knowledge. The media is always respected and expected to spread these things. So we are lucky enough that we are celebrating this day. And you see, our host is now at present in Bangkok, in Thailand. So he is, of course, Professor Pawan Sharma is there. I am here in Pune, and Nishanji is Delhi. And persons are from every walk of life completing our great nation from Kashmir to Kanyakumari and all that. With these initial words, I again welcome you all and do hope that we are going to be enlightened with the knowledgeful experiences which will be shared by you. So thank you very much, and over to Professor Pawan Sharma. Namaskar.
Thank you very much, sir. प्रोफेसर AYUSH शर्मा जी का स्वागत है मॉरिशस से।
नमस्कार सर, नमस्कार सभी को।
अलका, नमस्कार जी। डॉक्टर अलका गुप्ता थाईलैंड से जुड़ी हुई हैं, स्वागत है, उनका भी स्वागत है। मैं आज सोशल मीडिया की महत्ता को कोई भी अनदेखा नहीं कर सकता। इस समय मैं भी अलका जी थाईलैंड में ही हूँ। तो
कहाँ है सर आप इस समय?
मैं बैंकॉक से इस समय तो अभी भोलेनाथ के दर्शन करके आया हूँ।
अच्छा, बैंकॉक में कहाँ रुके हुए?
होटल में था, अभी तो मैं चेंज कर रहा हूँ। आप बैंकॉक में हैं?
हाँ, मैं अभी बैंकॉक में हूँ।
मैं संडे को देखता हूँ, संडे को मुलाकात की बात करते हैं।
संडे ओके, नेक्स्ट संडे या कमिंग जो अभी आ रहा है, तो उसमें मे बी कि मैं मतलब आप मुझे कंफर्म बताएं, मे बी मैं फुकेट जाऊं।
ठीक है, अपन वेबिनार के बाद बात कर लेंगे कंटिन्यू।
हम लोग
ओके सर, तो आई वुड लाइक टू इनवाइट नाउ निशांत वर्मा जी। वेलकम निशांत जी। आपको 2 घंटा दूर जाना है घर में, मैं जानता हूं, तो मैं निशांत जी को स्वागत करता हूं।
थैंक यू सर, थैंक यू प्रोफेसर पवन शर्मा जी, थैंक यू प्रोफेसर अग्निहोत्री सर, राधिका मैम, Professor AYUSH Sharma ji, and Professor Tiwari. Thank you all for having me here. Since today is this, we are celebrating Social Media Day, and topic for today's webinar is social media for healthcare sector. So I will keep my session really short. Like Professor Pawan Sharma said, I actually have to wrap up really fast. So we'll touch upon the various aspects of social media. I mean, social media, we are all aware today that it is, I think probably we spend more time on social media than anything else these days when it comes to communication, because it is readily available. You don't have to wait for the next day to receive your newspaper or switch on the TV channel. I mean, everything is on mobile, and it comes with its pros and cons. Nowadays, people are getting addicted to social media, so it is become, there are both boon and bane. So we'll touch upon that as well, and we will also touch upon how do we harness the power of social media in healthcare sector, and then we'll also touch upon the patient doctor relationship that can be leveraged upon through social media, and the kind of role that social media has already played in terms of research and data analytics. And we'll also touch upon the ethical and regulatory challenges that the communicators face when it comes to communicating through social media. So starting with harnessing the power of social media, I would say we need to explore how social media can be utilized to disseminate accurate health information. I mean, the keyword here is accurate, because there is a huge scope of spreading false information, fake news, and there are huge, uh, you know, outcomes of fake news that and the impact is way too big these days, especially the kind of misinformation available on social media. So we need to, as healthcare professionals, we really need to be sure of what we are posting. We need to give it a thought before posting, give thorough research, and because we all tend to get swayed with whatever information that is fed to us on social media. So we, as professionals, should be also the agent of fact checkers, and disseminate the right kind of information for a bigger good of the society. So because social media, we've already seen the kind of power it has, how it has impacted, especially like Professor Agnihotri said, COVID is the freshest example that we have, the kind of role that social media played, especially in healthcare sector, from giving out the information as well as the misinformation. So I think one of the biggest example that we are lucky to have witnessed. I mean, we are lucky and unlucky both to have witnessed this pandemic, and all the learnings that I personally have had managing the social media for my organization, and also a bit of role that I played in the national communication of from the industry that I belong to, from the government side. We were supplying oxygen as well to the rest of India through our steel plants. So there was a huge, data that was being shared with the government, with the people involved, giving out the right information, and where we were setting up the jumbo COVID hospitals. We had set up almost 8, 9 jumbo hospitals across India, where we were treating COVID patients. The oxygen supply, the kind of information that we were giving out was also helping the country, to calm down a little in terms of the oxygen requirement that was there. There was definitely a scarcity, but when the Prime Minister Narendra Modi himself, he was monitoring the oxygen supply across the nation, and the way the crisis was being managed, I think no other country has been able to do it so well the way we have done, despite all the the number of mortality rate that was there. I mean, we've seen a big country like United States of America. I mean, how they suffered, or the so-called advanced European countries. But the way we managed and we leveraged social media during that crisis is a case study for all of us to learn from. So this is one part of it, like how social media played a huge role in managing crisis communication. And now coming to the doctor-patient relationship, we've seen a lot of doctors now having their own YouTube channel, and the way they are utilizing the social media is helping them gain the business, getting the followership. So it is more of a 360-degree marketing for them, that through, if they are getting famous on social media, they're also getting patients online and offline. So that is helping them in terms of their business, as well as it is a big tool for marketing for the doctors, and as well as patients are also finding it easier to reach out. Now, coming to the role of social media in terms of health research and data analytics. We've seen so many research on social media. You send out, it is easier for the researcher also to reach out to their target audience, to fetch the data, both primary and secondary data. And then it gives you a ready matrix, because since it is a digital platform, it gives you the exact data of how many people have filled the data, and it does provide a lot of authenticity to data. Now coming to the next topic, I would talk about the addressing the misinformation that is there and to improve the health literacy in the country. So we need to, for example, during the pandemic, there were many misinformation and fake news being circulated on social media. There were videos of some other country being shown as Indian, that that people are dying, lying here in the mortuary on the roads and this and that. And they were all, I mean, the fake news of some other country were being shown as the Indian videos. So which was, I mean, so there are bodies who do fact checks. Some are authentic, some are not so authentic, because there are now even we can't even trust the fact checking agencies, because they are, so we realize that they are also somewhere politically aligned towards this party or that party. So the fact checkers are not also the authentic source of fact check. But there is one site that I personally go to, which is a government PIB fact check. It's a Telegram group also. There is a WhatsApp group also. You can Google PIB fact check. You can get the data of all the fake news. If you find any fake news, you can report it there as well. So there is a huge scope of fact checking agencies, especially in terms of health care, because this is one area which actually impacts all of us, the public at large. And we've all seen now even the conspiracy theory about the Wuhan virus, the what do you call this? Recently, it came out that it was a bio warfare. The virus was being made in Wuhan lab, funded by this foundation, that foundation. So there are many. We still do not know. I mean, the international websites are showing it. We are living in a kind of world where we do not know what is right and what is not. I mean, you cannot trust the biggest names, including the United Nations, the WHO. I mean, they came up now. There is a huge contradictory theory towards the vaccination also. So I don't know where it ends. So the huge scope, but as healthcare professionals, whatever, since we are the authority when it comes to talking about anything that is related to health, because people believe that since you've studied in that specialized field, so what you say has a backing towards what you're saying. So your word matters. So I think you need to put out more well-researched data or through your social media, utilize various tools, be it Twitter, Instagram. There are many pages on Instagram, which I personally follow, because Instagram is more youth-oriented, more visual-oriented. So there is a scope of getting a visual knowledge of things, because Twitter is more text, but Instagram is more visual, so it attracts more youth. And we like what we see, so and we like to also believe what we see. So that ways Instagram is the place for actually mitigating communication related to healthcare, apart from Twitter, that is there as well. But I personally feel, if you want to connect to youth and be more realistically connected towards your audience, so Instagram is the place for you. Now, coming to how do we mitigate the negative effects of social media? So, social media, the impact of social media is not just mere mental. It also affects your body, your well-being, your psyche. I mean, it is the overall health that gets impacted by social media. So how we communicate and what we communicate, the impact is huge. I mean, it is not just emotional. We've seen so many people committing suicide due to depression that they face, due to some harassment or something, some issues that were actually pertaining to social media. So social media is not a non-serious thing. I mean, we as communicators should always take it seriously, because it is also one of the modes of communication which actually impacts people directly. I mean, we've seen there was this game, Blue Whale Challenge or some I think Blue Whale Challenge, there was this Chinese game where people had to started committing suicide because they got so much intrigued into that game. And the final stage of that game was that you actually have to commit suicide yourself. So we had seen that part. Social media is a very serious affair, and it does impact your mental health, your physical health, as well as your holistically your personality, your persona. Also, we've seen, how culturally people are changing due to the information, the content being available. You don't have to be a Brazilian to see the Brazilian content, or a Colombian to see the content from Colombia. So the intermingling of culture. I mean, somehow, I mean, I think there is a huge responsibility of parenting when at a younger age. The parents needs to act as the mentor for their children, because we are going to shape up the next generation also, and this impact of social media is going to impact, well, like the country overall when it comes to their, I mean, culturally, traditionally, there a lot, and we are going through a huge disruption due to social media. So there is a huge impact on the healthcare sector as well. Then I would like to just conclude with a few recap points, that the impact that it had on COVID, we've all seen. It was a huge case study, how social media, how the government of India utilized social media for disseminating information, the how the government is still using it for to communicate their schemes, their health schemes, the Ayushman Bharat, and the Ministry of Ayush is utilizing. We've all seen the International Day of Yoga being covered on social media, and how India has actually hugely benefited out of communicating that International Day of Yoga through social media. I mean, I, if you remember during my last webinar, I said, if actually we one day, if we dream of having one world or having an interconnected world, yoga could be one of the biggest tools that can connect the world. And this today, what we see of on the social media during the International Day of Yoga, the world is coming under one roof, and yoga is one of the connecting tools that India has actually leveraged, and I think it should have used, because it is the kind of dharohar that we've always had, which we underutilized. But we have seen जब अमेरिका में होता है तो चीजें लगता है कि बड़ी हो गई है. So योगा जब अमेरिका पहुंचा तो बड़ा हो गया, and our prime minister has been a great brand ambassador of the country, and so is our minister of external affairs, and I think the entire ecosystem is working for the country, and we as a nation are connected as a team. We are doing much better than the world. I mean, it is for everyone to witness, and we as individuals can contribute our bit by being responsible on social media, because what we write, I think, reflects on our nation as well. So this would be my concluding remarks, without wasting much of your time. I think I would conclude here, and thank you everyone for having me here once again.
Thank you, Nishanji. Thank you very much.
Thank you,
Thank you
sir.
very much for joining, and really for inspiring speech. Excellent, excellent.
Thank
You
you
have
so much, sir.
highlighted role of social media in pandemic and post-pandemic situation. Definitely, social media has important role. Our Ministry of AYUSH has launched so many apps that cannot be accessed without social media. And it is also reality that WhatsApp University is teaching us unwanted, undesired material also. Thank you. Thank you very much. Now I would like to request Dr. Radhika Nagaraj for her valuable speech. Thank you, Nishanji. Thank you.
Thank you, sir.
Thank you.
Om to all. Thank you so much, Nishant sir, for your valuable inputs. You very rightly said that it's a time that we realize that the information sharing is not important, but the sharing of right information is important. And in COVID times, you highlighted many things. So I also start my talk with the this topic only, social media for health awareness. What government has taken up, what Ayush Ministry has started recently for the spread of valuable information to the users, to the people. The Ministry of Ayush, under its Central Sector Scheme for Promotion of International Cooperation, undertakes various initiatives for international propagation. I stress on this: international propagation, promotion, and global acceptability of Ayush systems of medicine. And for this, we know, since I deal also exports in my pharmacy, so this Ayush Export Promotion Council, which has been set up. So whatever initiatives they are taking, wherever seminars are being held, wherever exhibitions are held, that is passed through the social media, through the messages, through the apps, which Ayush Ministry is very frequently and liberally using. And AEPC intends to promote export of Ayush products, services, medicines, and hospitals. They also encourage the hospitals to participate in uh, the exhibitions wherever they are putting up, and all this information is disseminated through press releases which are given to different media, and they are further circulated by social media. Even the information officer, the state information officer, district information officer uses social media to propagate the press releases and information. That is the right use of social media, I should say, which everyone has to do and must do. All agencies must follow this. So the government has formed Champion Services Sector Scheme for medical value travel to amplify medical tourism. Of late, this has come a very handy tool in places like Uttarakhand, where people come here just for their medical treatments. I'm associated with Patanjali Yogpeeth, and I know that at least 10 calls a day I do receive from different parts of the world asking for treatment they want to have in Yogram or Niramyam, other places. So various policy initiatives to promote this Indian traditional system, whether it is by a private trust like Patanjali Yogpeeth Trust, or the government, or the National Ayush Mission. It is to provide better access to Ayush services, and all the facilities which are available, like we have 12,500 Ayush health and wellness centers under Ayushman Bharat and other yojanas. Now, organizing fairs by Ayush Ministry, this has been a very positive tool, and the information which has been passed on through social media, it was really helpful to many organizations. Like I again talk about Patanjali Yogpeeth. We were the first one to register for the Ayush fair, which was held recently in Nepal, and the kind of response we got was tremendous. Now, coming to the second point, as Nishant sir also mentioned about patient-doctor relationship. For this, I must say that it has been social media has been so useful, because once the patient visits to the doctor, he explains his ailment, and there are still many things which are left out, and suddenly he remembers, oh, I missed to communicate this to my doctor, and the doctor has already prescribed the medicine. So they want to contact the doctor again. Doctor is busy. So the best method is you leave the message to the doctor. Whenever he or she is free, he will respond. And this is I personally have experienced that many people who visit our hospital, they are not aware of the facilities over there. They never know that they have to get the reports. So most of the times the reports, their data, patient data is shared through the media, and which we pass on to the doctor. And a fabulous thing has come that we have made a database of 1 crore patients from all over the world to do some research on the medicines. And this could be made possible only through the media, only through the apps, only through the social media, which they use to send their information. So I can say that social media has been very, very useful for doctors to analyze, to connect to the patients and give the right diagnosis and treatment to them. Whatever is missed out, that social media covers up. Also, when any agency prepares the authentic data, so that needs to be or authentic data about medicine, about the new research, the new products they have launched. So that information needs to be shared to the people. And I think the best medium is social media. If I share today that the such and such tablet has been launched, another person sees it, he or she recommends to the other, and like a virus, it spreads all over that something new is there in the market, which can capture, which can help you keep certain disease at bay. And COVID, yes, it is the best example. We realized recently that whatever new, we launched Coronel, we launched other products. AYUSH department had made its own concoction, and wherever it was made available, the information, the nearest store where it was available, it was shared on social media. So that helped propagate the medicine to the last person. That was a very effective use, and that could be made possible only through social media. Now, a survey says that 50% of the people use social media only for fun, only for making relations, like Snapchat, WhatsApp, Facebook, they use only for sharing their own photographs and how they look and just to get likes. But the 50%, rest of the 50% segment who is really serious about health, they look for new products, new researches in the medicine industry. And I think slowly, when one gets bored, because with these temporary things, we are bound to get bored, and when overload of information is there, naturally that stops pleasing us. So this 50% segment will increase definitely, I'm very sure, in times to come, because we have seen the COVID times. Now we are seeing otherwise stress related disorders which are occurring so much in the youths. So slowly, the segment which is more on social media, the youth, they will definitely come to the serious business of social media, I'm very sure. And for health educators, I just, as I mentioned, and students for research purposes, if they use social media, like they design a Google form, they post it on WhatsApp. I'm associated with Chinmay Degree College, and recently students did this exercise. They were to do a project on intravenous medicine, how that was helping a certain segment of the people. So they designed the Google form and they have put it on Facebook. They made a page, and within 2-3 days, they got the data, what they wanted. The survey was done, and now the project report has been submitted to the university. So this is a live example. I can say that social media can be used very effectively for research purposes, for collecting the data, for doing the survey, which otherwise used to take so much of time earlier. And so I can say that social media has an enormous potential to exchange information related to healthy behaviors of people, prevention, treatment, management, and care of diseases. In the past, health educators have used social media to create support groups. In Ramakrishna Mission, I'm associated with Ramakrishna Mission Sevashram in Haridwar, and they have a diabetes support group. They have monthly meetings in that group, and whatever deliberations are made, because those type 1 diabetic people, they are diabetic right from birth, and mostly they are children aged from 4 to 22. These kids and youths who are suffering from diabetes, they attend the monthly support group meeting in the hospital. They are used to taking insulin every day on their own, and the progress report they do share on groups and social media, which inspires other diabetic people also, that how they are managing their diabetes so well. So why can't they do? It is so inspirational that the group, which started with 20 people, has now grown up to 350. So that is the impact of social media. I have seen, that is a real life example I have observed in Ramakrishna Mission Sevashram of Haridwar. All said and done, it has got so much of positive impact, but at the same time, as a former speaker also said, misinformation can lead to disaster. So we must take care, and certain apps or screening tools must be designed by cybercrime team and other IT professionals, which can help us to tag that this information is not correct, this is not accurate, or there is a doubt. So I feel that IT people have a lot of role in designing such screening tools and apps, which can help people come out of harassment if if some wrong information is shared. And of course, regarding health information published on social networks, several authors have also suggested their ways, so which I think can be shared in a separate lecture, because that needs a separate core group to analyze what different authors have shared the information on the same, and this can be helpful. So lastly, I want to share one cardiologist from Washington, DC, Dr. Sushil Sharma, who is running a group of integrated wellness. He combines both allopathy and Ayurvedic and yoga to disseminate the information. He holds regular lectures, and it is shared on social media afterwards, YouTube streaming like we have for this session also. So that is very, very useful. And Haridwar, unfortunately, doesn't have good cardiologists, good experts. So sitting here in Haridwar, I can access the information which this cardiologist is sharing on day-to-day basis, some healthy tips which he's giving. So that is being shared through YouTube and Facebook. So I feel there can be no better use of social media than this to spread the good word by the experts, by the doctors, whom we really need in times of need. So thank you so much. With this, I wrap up. I thank Dr. Pawan Sharma and Dr. V.K. Agnihotri for giving me a chance to appear in this platform, and where all scholars and academicians are there. And I hope in future also. I would be given a chance to be part of this team.
Radhika ji, thank you very much. Definitely, Radhika ji. You are inspiring speaker for our platform. We would definitely like to trouble you again and again. Thank you. अग्निहोत्री सर, आदरणीय अग्निहोत्री सर, मेरी आवाज जा रही है?
Namaskar. Thank you, Professor Pawan Sharma ji. It's a great pleasure that both
आपके यहाँ नेट कमजोर है सर, आप वीडियो ऑफ कर लीजिए.
in the media and basically they narrate all the sectors which are been regularly covered by media. They have committed role of media in so many sectors by many ways. Mr. Entrance, that we are doing in the field of yoga. Really, it touched me that he quoted the 1st June and it is
आपकी आवाज कट के आ रही है सर.
needed for the mouth also. Thank you, Namaste. And what our association with the soul itself, Patanjali developed pharmacy. Apart from that, assembly and this Chinmay Degree College and also Ramakrishna Mission Sevashram. These are very key sectors where she is working a lot, and she pointed out that project of Chinmay Degree College. Rightly, this is what the media can do, especially for the data collection, filtration, and giving of the shape of an information. So this is, she is doing very well. At the same time, she is making so many efforts of charity by making persons united and contribute for the suffering humanity in the hospitals and all that. So thank you very much. And we do hope that you will always be with us and will remain repeatedly and will share your thought whenever we will in need of. Thank you so much. Over to Pawan Sharma.
Thank you so much, sir.
Thank you very much, sir. Thank you very much. Thank you, Madam Radhika ji. Thank you for joining today. Now I would like to request Professor AYUSH Sharma ji from Mauritius for his valuable comments.
सभी को नमस्कार सर, और लाभान्वित हो रहे हैं सर, कुछ बोलने के लिए सक्षम तो नहीं है, तो बड़ा यूनिक टॉपिक आपने चुना है, साधुवाद आपको, और कुछ लाभान्वित हो रहे हैं सर.
आपके मॉरिशस में भी कुछ ऐसे सोशल मीडिया ग्रुप्स हैं क्या आयुर्वेद या हेल्थ के लिए?
जी हैं, पर बहुत ही लिमिटेड है, बिकॉज इट्स अ वेरी स्मॉल प्लेस, तो ज्यादा कम्युनिकेशन नहीं होता है, और लाइक बहुत ही लिमिटेड है सर.
जी थैंक यू AYUSH शर्मा जी. मैम नवीन गुप्ता जी को लंदन से जुड़े हुए हैं हमारे साथ. नवीन गुप्ता जी को उनके कमेंट्स के लिए. डॉक्टर नवीन गुप्ता जी फ्रॉम यूके लंदन, वेलकम.
नमस्कार सर. नमस्कार
सर.
सभी को बहुत बहुत नमस्कार. और मैं थोड़ा अभी ज्वाइन किया हूँ और केवल ईश जी को सुना है, और उन्होंने भी अपना साधुवाद प्रकट किया है. मैं भी अपना साधुवाद प्रकट करके माइक देता हूँ आपको वापस.
थैंक यू.
यहाँ पे तो कुछ नहीं है जी. यहाँ पे हमने तो सोशल मीडिया में अभी कुछ ज्यादा सुना नहीं है. कुछ लोग फेसबुक प्रेजेंट होते हैं, और ऐसा कुछ सोशल मीडिया पे नहीं आ रहा, लेकिन अभी लग रहा है कि आर्टिफिशियल इंटेलिजेंस बहुत ऊपर जाएगा आयुर्वेद में, और हमने भी शुरू किया उस पे काम, और तब देखते हैं सोशल मीडिया क्या रोल आएगा. और बस यही कह सकता हूँ भी तो मैं.
थैंक यू. कोई और भी ऑडियंस में से सोशल मीडिया के रोल पे यदि बोलना चाहे तो प्लीज रेज योर हैंड्स. वी वुड लाइक टू इनवाइट यू. देन वी विल स्टार्ट आवर सेकंड वेबिनार. If anybody would like to add anything.
Sir, there is a very small observation, which if you permit me, I can...
Welcome.
Sometimes we see that there are groups where like we Vaidyas are there or medical experts are there, and still somehow like in this pursuit of just forwarding the messages, we are even forwarding like non-technical medical education messages. So that is where we, because once you send it, then it becomes more authentic that a doctor has sent that to me. So we have to filter it really very responsibly, as per the original concept of Nyaya Darshan. The validity of the source, the authenticity has to be confirmed. And if it is not from medical subject, then we are not at that much of fault if we forward it. But when a doctor's group is forwarding and circulating, then it becomes really a very big responsibility. So everyone is like becoming more responsible, I believe, and things this stigma would also go away soon, I believe.
You're right, sir. We are hopeful. Now, it should happen, and it is a need of the hour. It is a need of the hour.
Thank you, Radhika.
At least medical fraternity has to take this role very seriously and just not keep on forwarding, because everyone trusts the doctor. Everyone trusts.
Very rightly said. Very rightly said. हमारे साथ अलका गुप्ता जी थाईलैंड से जुड़ी हैं। डॉक्टर अलका गुप्ता जी, आपका स्वागत है। यदि आप कंफर्टेबल हैं तो आपकी ओपिनियन।
हाँ सर, नमस्ते। मैं वीडियो अभी नहीं ऑन कर पाऊंगी, हाँ, लेकिन बात कर सकती है। हाँ,
कोई बात नहीं मैडम।
डेफिनेटली सोशल मीडिया के अपने प्रॉज एंड कॉन्स दोनों ही हैं, और कोविड में ये सबसे ज्यादा निकल कर आया। मैंने खुद करीब 148 वेबिनार्स किए अलग अलग सब्जेक्ट्स में और टॉपिक्स में, और लोगों को बहुत इसका लाभ भी मिला। लेकिन हाँ, ये जैसे अभी पिछले स्पीकर ने बोला कि एक ऑथेंटिसिटी, एक स्क्रिप्चर बेस्ड जो नॉलेज है उसका स्क्रूटनी और उसका फिल्ट्रेशन बहुत जरूरी है, लोगों तक पहुंचना। अदरवाइज फिर उसका जो मैसेज है वो हमारे जो आयुर्वेद, योग, नेचुरोपैथी, इन सब विधाओं का एक गलत मैसेज जाता है, और उसमें फिर लोग गलत ढंग से चीजों को करते हैं, और फिर ब्लेम भी उसी पर आता है कि भाई हम तो इतना ये सब कर रहे हैं लेकिन हमें तो कोई लाभ नहीं हुआ या कुछ। तो इस पे एक कुछ ऐसा लॉ या कुछ भी ऐसा होना चाहिए कि एक फिल्ट्रेशन हो, सही जानकारी जाए। और मैं भी पतंजलि की मैं फाउंडर मेंबर हूँ सिंस लास्ट 28 ईयर्स। स्वामी जी के साथ एसोसिएटेड हूँ बहुत समय से, और यहाँ पर बैंकॉक में मेरी अपनी हेल्थ केयर एंड वेलनेस कंपनी अगाथ हेल्थ केयर के नाम से पिछले 15 सालों से मैं यहाँ पर हूँ। और यहाँ का जो बिगेस्ट कॉन्ग्लोमरेट सीपी ग्रुप है उसमें मैं ऑनरेरी एडवाइजर हूँ। जस्ट लाइक अंबानीज इन इंडिया, सीपी ग्रुप यहाँ पर है, और वो हेल्थ और न्यूट्रिशन में भी, आयुर्वेद में अभी उतरे हैं, और कई सारे आयुर्वेदिक प्रोडक्ट्स अभी यहाँ थाईलैंड के उसमें आए हैं, जिसमें मेरा एक की रोल रहा है, उसको फॉर्मुलेशन एंड उसमें। तो यहाँ थाईलैंड में तो काफी अवेयरनेस है। यहाँ की यूनिवर्सिटीज में रंगसित से मैं एज अ गेस्ट स्पीकर में जाती हूँ, ओरिएंटल मेडिसिन डिपार्टमेंट में। वहाँ पर यहाँ थाई ट्रेडिशनल मेडिसिन सिस्टम और जो अपनी इंडियन ट्रेडिशनल मेडिसिन सिस्टम एक इंटीग्रेटिव, वहाँ पर ऐसे कॉन्फ्रेंसेस होते रहते हैं। सिल्पाकॉन यूनिवर्सिटी है, यहाँ मैडोल यूनिवर्सिटी है, यहाँ पर एजुकेशन सेंटर है। तो इस तरह से यहाँ पर थाईलैंड में है अवेयरनेस। और जो यहाँ का कल्चर सेंटर है ICCR, उसमें भी मैं एडवाइजर हूँ। यहाँ के आयुर्वेद के जो प्रोग्राम होते हैं, योग के जो प्रोग्राम होते हैं, तो कह सकती हूँ कि थाईलैंड में एक अच्छा भविष्य है हमारी भारतीय चिकित्सा पद्धतियों का, और इसका प्रचार प्रसार अच्छे से हो रहा है।
थैंक यू फॉर द इंफॉर्मेशन। मैं भी अभी एक नेशनल कन्वेंशन में आया था जो आपके इम्पैक्ट सेंटर में हुआ था, वहीं नोवोटेल इम्पैक्ट में रुका हुआ था। तो वो कल एक्सकर्सन भी हुआ, तो वो पूरा का पूरा एक अच्छा लगा। थाईलैंड में ट्रेडिशनल मेडिसिन का बहुत बड़ा स्कोप है, बहुत बड़ा स्कोप।
हाँ, यहाँ पर
और
लोगों
कोई
का
ये
बिलीफ
देखो,
सिस्टम है, हर्ब्स में खासकर हर्बल मेडिसिन का अच्छा यहाँ पर स्कोप है। पीपल लाइक बिलीव भी करते हैं डे टू डे लाइफ में। खान पान दो मतलब यहाँ ये मांसाहार देश है, लेकिन इसके बावजूद भी एक जो कहना चाहिए खाने का तरीका है या और भी जो चीजें हैं वो एक हेल्दी है, हेल्दी वे में हर्ब्स का यूज करते हैं। कुकिंग मेथड यहाँ पर सीखने लायक है। यहाँ पर और भी बहुत सारी चीजें हैं जो हम इंटीग्रेट कर सकते हैं अपने आयुर्वेद के साथ, और उसको हम एक मतलब एक अच्छा कैनवस दे सकते हैं, अच्छा आयाम दे सकते हैं। तो थाईलैंड में काफी इंडियन उसमें कल्चरल और कहना चाहिए ट्रेडिशनल मेडिसिन में काफी सिमिलरिटी है, और आयुर्वेद को यहाँ के लोग एक्सेप्ट करते हैं।
थैंक यू। मैं आपकी लीडरशिप में एक थाईलैंड के ऊपर वेबिनार रखना चाहूंगा। कृपा करके जितने आयुर्वेद वाले हैं उसमें जोड़िए। बड़ा अच्छा लगा। हमारे यहाँ से विजया हमारे फॉर्मुलेशन में गायब हो गई, और यहाँ तो लोगों ने रिक्रिएशनल कैनबिस सेंटर खोल रखे। हमारे यहाँ वो 20 रुपए की गोली, और मुझे तो मालूम पड़ता है इंडिया में पूरा सीबीडी और टीएचसी नालियों में बहा दिया जाता है, क्योंकि हमारे आयुर्वेद की परंपरा विजया को शोधन करके प्रयोग में करने की है। और यहाँ टीएचसी सीबीडी, अरे बाप रे बाप, कितनी दुकान देख रहा हूँ। और हमारे यहाँ पूरी बंद हो गई आयुर्वेद से। विजया
हाँ,
खत्म।
लेकिन यहाँ पर जिस तरीके से गवर्नमेंट ने कोविड में ये चीज शुरू की, वो पर्पस एक गलत था और गलत तरीके से कि उसका गवर्नमेंट को इम्पैक्ट समझ में आया, खासकर यूथ में। तो अब उसमें वो फिर से अब कुछ लाने वाले हैं अमेंडमेंट। तो कोविड के समय ये शुरू किया गया था, लेकिन इसमें प्रॉपर एक पूरा होना चाहिए। उस तरीके से नहीं, इन्होंने एक ड्रिंक की तरह जगह जगह हर 10 कदम में कैनबिस के मसाज सेंटर के साथ साथ एफिलिएट करके खोल दिए। तो वो एक अब गलत दिशा में जा रहा है वो चीज। तो अभी उस पर देखिए गवर्नमेंट काम कर रही है, और उसको एक मेडिसिनल वे में कैसे उसको कंज्यूम करना है, क्या करना है, क्या डोज होनी
जी
चाहिए,
जी
क्या
जी।
नहीं, वो अब आएगा।
अभी सिम्पोजियम में कम से कम 50 मैन्युफैक्चरर्स थे जो मेडिसिनल कैनबिस के प्रोडक्ट्स बनाते हैं।
हाँ हाँ, यहाँ पर मतलब बता तो रहे कि जस्ट लाइक कि जैसे बिस्लरी पानी होता है वैसे ही
वैसे कैनबिस वाटर मिलता है।
हाँ, यहाँ पर लीगल है, मतलब लीगल है, गवर्नमेंट ने ही कर रखा है, तो उसमें आम जनता है। अब लोग, पेरेंट्स ही अब सफर कर रहे हैं। बच्चे अब वो कैंडीज में स्कूल के आसपास बिक रही है, अब उसमें बच्चों का हार्ट प्रॉब्लम हो रही है, हार्ट अटैक्स हो रहे हैं, बहुत सारी कैजुअलिटीज हुई हैं, फैटलिटीज हुई हैं। तो अब जब इस तरीके की चीजें हो रही है, गवर्नमेंट को समझ में आ रहा है कि नहीं, ये डिसीजन उस समय रेवेन्यू और फाइनेंशियल स्टेटस और उस चीज को और टूरिस्ट को अट्रैक्ट करने के लिए ये सब चीजें कर दी गई। अब देखिए क्या होता है।
थैंक यू वेरी मच राधिका जी। थैंक यू फॉर ज्वाइनिंग। थैंक यू अलका जी, और थैंक यू फॉर ज्वाइनिंग। जुड़ती रहिएगा। और थाईलैंड में 5-7 स्पीकर्स के साथ में हम वेबिनार करना चाहते हैं। अभी से हम आपसे प्रार्थना कर रहे हैं, आप जब भी हमें फोन करेंगी हम ऑर्गेनाइज कर देंगे।
जरूर सर, एक रेलिवेंट टॉपिक पर जो दोनों देशों को कनेक्ट करेगा, और मैं कोशिश करूंगी कि यहाँ के जो यूनिवर्सिटीज के जो यहाँ के डीन्स और एसोसिएटेड हैं लोग, उनको मैं कनेक्ट करूं उस वेबिनार में, ताकि दोनों पक्षों के स्पीकर्स को ज्ञान का जो शेयर हो, नॉलेज शेयरिंग हो।
Thank you very much. So nice.
Thank you.
Now I would like to request Agnihotri sir to conclude the webinar. आदरणीय अग्निहोत्री सर, आपकी नेट कमजोर है सर, आज वीडियो मत ऑन कीजिए।
जी नेट जी, अच्छा ठीक है। थैंक यू वेरी मच प्रोफेसर पंकज जी। So in this way our first webinar numbering 813 is completed with the submission of our distinguished guest speakers, and we also followed the discussion with certain points with the presence of Dr. Alka Gupta, that too from Thailand. Also we have a great suggestion